Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Saturday, November the 7th. Honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh peoples. We're honored and thankful to them for allowing us here today. We're obviously having this briefing today. We'll be having another briefing Monday at 3 o'clock in the Press Theatre in Victoria. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. This is another challenging day for us here in BC. And I will start by announcing that we have 567 new cases reported today in British Columbia of COVID-19, bringing our total to 17,716 people in BC who've been diagnosed with COVID-19. The new cases include 122 people in the Vancouver Coastal Health Region, 411 people in the Fraser Health Region, 3 people on the Vancouver Island Health Region, 22 people in Interior Health, and 9 people in the Northern Health Region. We now have over 100 people who are in hospital, 31 of whom are in critical care or ICU. In addition, we have one new healthcare outbreak, the residents in Mission. So we now have 37 active outbreaks in our healthcare system, in 33 in long-term care and 4 in acute care sites. This abbreviated numbers that we have today is the reason we are having this discussion on this briefing today. As you know, in the last 2 weeks, we have seen a dangerously high and rapid increase of COVID-19 cases and outbreaks affecting primarily our healthcare system, but also many other places in this across the province, but particularly here in the Fraser Health and Vancouver Coastal Health regions. We are also watching what has happened around the world, and we are not alone in seeing this rise in cases. We have seen them in jurisdictions all around us and around the globe. We have had transmission in a numbers of workplaces where the virus has really accelerated, including fish processing, food processing facilities, some retail locations, places like car dealerships, indoor group physical activities, and other places around the province, but particularly concentrated in this region. We have had many episodes of transmission in people's homes over the last few weeks, as we know, and we have talked about this. We've also had transmission in healthcare facilities across the Lower Mainland. The result is that we are seeing a steady increase and worrisome increase of people with serious illness requiring hospitalization and intensive care. From the outset of our pandemic, the goal of our COVID-19 response has been to maintain capacity within our healthcare system so that we can support and care for people not only who are suffering from this virus, but for all of the other healthcare needs that we have. To protect those who are most vulnerable, particularly now we know our elders and seniors, as well as to keep as much as possible going in our communities, because we know that as well has effects on our health and well-being. We need to keep our essential services and essential activities from schools to workplaces open and operating safely, and right now this is in jeopardy. As a result, we will be taking further actions, and we must now step back from our restart activities. We need to take urgent and focused actions here, in particular, in the Vancouver Coastal and Fraser Health regions, to avoid the serious consequences for all of us, not just in this region, but around the province. Today, I am putting in place new provincial health officer orders for all individuals, places of work, and businesses in communities within the Vancouver Coastal and Fraser Health regions, with the exception of the Central Coast and Bella Coola Valley. The orders will be in effect for the next 2 weeks, from today at 10 p.m. through to Monday, November 23rd at 12 p.m. This will give us a chance to stop the transmission, to have a break in that rising transmission rate that we are seeing. And we need to focus our attention on that now. The order will focus on 4 areas, or the orders: on social gatherings, on travel, on group physical activities, on indoor group physical activities, and on workplace safety. Right now, it is very important that everyone in these areas of Vancouver Coastal and Fraser Health significantly reduce their social interactions. We also need to better manage indoor group physical activities where we have seen rapid transmission of this virus. We also are requiring all businesses and work sites in this area to revisit and ensure strict adherence to COVID-19 safety plans and adequate COVID-19 safety plans. And we will be working with WorkSafe BC, with our public health inspectors and our bylaw officers around this region to facilitate that. I know this is hard. I know we don't want to have to be doing this. And we need to support each other right now to make this break. We appreciate that this takes a sustained daily effort, and these efforts are critical to keeping our businesses, our schools open, and our communities safe as we go into winter. So today's orders include, in more detail, for social gatherings, there are to be no social gatherings of any size with anyone other than your immediate household. This includes indoor gatherings of fewer than 50 people, even in controlled settings. So it supersedes our mass gathering order that we have had in place for some time. Funerals and weddings may proceed with your immediate household, but there are to be no associated receptions inside or outside your home or at any public or community-based venues. This is a time-limited order, but this is what we need to do now. We need to stop our social connections where we unfortunately are seeing this virus spread, and spread to those that we are closest to and that we care most about. For travel, we are strongly recommending that travel into and out of areas of Vancouver Coastal and Fraser Health should be limited to essential travel only. Those who live outside these areas should not visit unless it is urgently required or essential, and travel through only when needed. In addition, travel for sports into and out of this region is suspended for this period of time. In terms of group physical activities, this unfortunately is an area where we have seen spread in multiple different settings. As of today, businesses, recreation centers, or other organizations, so they can be held safely. And these need to be approved by our local medical health officer. This includes spin classes, yoga classes, group fitness, dance classes, or other group indoor activities where people are increasing their heart rate, and we have seen repeatedly, not just here, but around the world, that these are venues that we see rapid spread of this virus, even with people who don't recognize that they are ill. Indoor sports where physical distancing cannot be maintained are suspended for these 2 weeks. This includes no indoor competitions or games for this short period of time. These activities can be replaced with individual exercise or practice and drills, as we did before we started phases of our Restart Our Sports programs. And that allows everyone to maintain safe physical distancing while participating in these important physical activities. And I will note that this is not applying to physical activities that are part of a school-based program. We also need to pay strict attention to increasing physical distance off the field of play. So areas like on the bench, or when we're warming up ahead of time, or in some cases where there's spectators. And our advice has been for the last few weeks that we need to reduce and or not have spectators, particularly at children's games, whether they're inside or outside. For workplace safety, all businesses and work sites must conduct active in-person screening according to our COVID safety plans for their workers on site now. We must go back to those plans and reinforce the importance that they have. Workplaces must ensure that all workers and customers maintain appropriate physical distancing, wear masks as appropriate, and be especially vigilant in small office spaces, in break rooms and kitchens. This is where we're seeing people transmit the virus to each other in our work settings. We also know that in some work settings, places like restaurants, when COVID safety plans and the new restrictions, reducing the hours, making sure that we have physical barriers, small numbers of people, that we don't see transmission of this virus. But we do see it when those plans are slip or when they're not being followed and adhered to religiously. And right now, we have to go back. And if we cannot maintain those plans, then local medical health officers will shut those businesses down. And we have seen that happen. And it may need for people, if they feel that they cannot maintain those COVID safety plans in a restaurant, then looking at other options like takeout only. In addition, we need to consider going back to actively supporting people working from home from certain businesses, if that is possible. Businesses, we will be, as I mentioned, increasing active inspections with Public Health, WorkSafe BC, and our bylaw officers in this local area. And we know that this has been hard for businesses. We have seen measures slip in some businesses, and that has led to transmission. So now is the time for you to re-look at your COVID safety plans, to go to the WorkSafe BC website, to update the plans and to reinforce them. And if you are a worker, you need to look at those plans and make sure that you're adhering as well. We need to redouble our efforts, as we are seeing multiple places where this is being transmitted within those settings and then spill over into healthcare settings, into our families, into our communities. We know that some of the facilities that provide these group physical activities, for example, have already taken steps such as screening participants, reducing density, increasing spaces, putting in physical barriers, and we know that some people have been doing a good job on that. What we are doing is looking at the literature around the world and what we know is safe, and we will be revising and updating the guidance from Public Health and from WorkSafe, and we will be working with the communities and each business and group to make sure that when you have appropriate safety plans in place, you can reopen. Finally, I'm also going to order that party buses, group limousines, and other perimeter seating vehicles, which is the technical names, are ordered to stop operating until further notice, effective immediately. As you know, provincial health orders are always a last resort. But right now, these additional measures are needed. They are needed here in this community, in Vancouver Coastal and Fraser Health regions, and I'm working very closely with our public health teams, our medical health officers in these regions to make sure that we can support all of the needs that we have in this community to keep everyone going and functioning with the essential services that we have. We need everyone to help us to keep this wall strong. We know that we need now to redouble our efforts to protect our hospitals, our schools, our families, our workplaces, our communities, and our elders. And now is a time that we need to do this. Despite being tired, despite the uncertainty, despite what has been happening for the last few months, this is the road we must walk. And right now, and we must walk it together. We need now more than ever to support our local businesses, our local schools, our local communities, and our own families. This virus has shown us that it doesn't recognize any of our geopolitical, social boundaries, and that we are all in this together, and we will come through it together. We will get through these challenges. We have flattened our curve in the past, and we will do it again. And it's going to be a challenge for all of us, but we must do it together. This next 2 weeks will be critical for us, and I'm calling on all of you to do this together, to do our part, and to remember how important it is to do this by being kind to each other, by staying calm, and by being safe. Thank you.
Thank you very much, Dr. Henry. And first of all, I wanted to start by expressing my condolences to the one person who's passed away from COVID-19, or to their families and friends and caregivers of the one person who's passed away from COVID-19 in the last 24 hours. We know for this family and for those caregivers, like in the case of the 273 people who have passed away from COVID-19 up to today, that this is an extraordinarily difficult time. It's a difficult time to grieve, and we are thinking of them, of that family today, and of all those families today as they deal with their grief. Over, as Dr. Henry has said, 567 cases of COVID-19 today. And just to put that in context, as you know, in the last 2 weeks especially, we've seen a significant increase in COVID-19 across our two Metro Vancouver and beyond health authorities, the Vancouver Coastal Health Authorities and the Fraser Health Authorities, from Chilliwack to North Vancouver and West Vancouver. Yesterday, an all-time high number of cases of 546. Today in those two health authorities, 533 cases. Hospitalizations have risen to just over 100, and while this is below the peak in the early part of April of 149 and well below our capacity to address it, nonetheless, it reflects the severity of COVID-19 in our province. In addition, I would say yesterday, and this is particularly important to Dr. Henry and myself, there were 7 health facility outbreaks declared in 24 hours from Thursday to Friday. There is one further one today, and this is a matter of serious concern to us. As all of you know, the level of COVID-19 and the response to COVID-19 and the levels of mortality and transmission have consistently been lower in British Columbia than other jurisdictions across North America and indeed across the world. That even in the last week, our rolling average of cases, a daily average of cases of about 8.5 per 100,000 here in British Columbia, and that compares to, for example, 108 in Belgium, or 60 or 97 in Switzerland, or 70 in France, or 30 in the United States. That said, we need to take urgent and focused action now to significantly bring down the rate of transmission across our two Metro Vancouver health authorities. Not doing so will have serious consequences for all of us, independent of our age, if our health care system in the Lower Mainland cannot provide the quality of care needed to respond to accidents, to surgical medical care due to increased sickness rates among healthcare workers, or excessive demands on inpatient beds. And that's why the actions announced by Dr. Henry are so significantly important. I want to note, and to continue to note, that the most intense public health effort of our lifetime is underway in British Columbia to keep us safe from COVID-19. The effort is massive in its size, scope, and commitment. Its importance is crucial to all of us. So is our ongoing individual duty, of course, to stop the spread and keep one another safe as we enter a winter of COVID-19. As all of you know, we have seen very little evidence of influenza so far, but we are expecting and we are entering respiratory illness season, and that will present continuing challenges for all of us. As I noted on Thursday, we have now hired an additional 580 total contact tracers, surpassing the initial target of 500 first announced in August, and provided approval to increase the total number of contact tracers to approximately 800 additional positions. We currently have 78 candidates in the offer process and over 300 candidates in the interview stage. In the Fraser Health Authority alone, we have added 259 contact tracers in the past 2 weeks and have approximately an additional 200 in progress. In the past week, we've increased our overall daily lab testing capacity from 16,085 to 18,633, and we'll exceed our target of 20,000 by the middle of the month.